Hello, my name is Douglas Mitzi and I'm a professional nutritionist, and I've been working in the field of allergies and food sensitivities and intolerances since 1990. In that time we've seen many tens of thousands of patients with regards to this problem, and I wanted to just share with you, as I share with my patients, a little bit about what allergies and intolerances are and what they mean to the average person in the real world. So primarily an allergy is a reaction to something, a defense mechanism to something which would not normally occur in the vast majority of people. And what we mean by that is if you have a reaction to some dusts or pollens, that shouldn't actually occur. That only occurs in patients whose immune systems perceive these types of reactions as being a threat to the body's own defences. As a consequence of this, the body initiates certain types of chemicals like histamines into the surrounding tissue area to facilitate other components of the immune system to get to the area quickly to neutralise the suspected toxin or invasion to the body, bacteria or whatever it is. However, these things are often a mistake because there is no virus, bacteria or toxin. It's normally a benign irritant which the body normally comes into contact with, whether it's some dust, foods, maybe things like some foods like wheat or dairy or tomatoes, and consequently these things shouldn't react with anybody. So the fact that they do, we normally term them as an allergic reaction or a food sensitivity, something like that. Now, in our experience, there's a couple of different types of allergy situations that we come into contact with. There's the one which is a fixed allergy. Now, fixed allergy primarily is, we all know somebody maybe at a school or a workplace or a family member, maybe that has something like a peanut allergy or an egg allergy or a shellfish allergy, something which is quite significant. And when this person comes into contact with this, even in very small amounts, a massive reaction occurs with massive amounts of chemicals rushing through into the blood, and often we can end up with that patient sustaining an anaphylactic reaction where the throat closes up, they can find it hard to breathe, and in some severe cases people can actually die from this. That's not a very common scenario. That's often quite a rare scenario. There's another group of allergies which are not fixed allergies, which we'd like to term as variable load sensitivities, and these things can occur and become variable depending on the amount of irritants that the person comes into contact with. So if they're eating lots of wrong types of foods which are termed as being intolerant to them, in addition to how well their immune system is at the time. So if somebody's under a lot of stress, they're suffering with lots of colds or infections or cold sores, they're not eating properly, then they need less of these triggers to initiate a particular type of reaction. If their immune systems are good, they're eating well, they're looking after themselves, maybe they're taking some supplements, then often these patients may need a significantly higher amount of this irritant to initiate the same type of reaction. So we like to call these variable load sensitivities. Variable because they depend on many other factors rather than a fixed allergy. So primarily an allergy or a sensitivity, for the purpose of this presentation, is something that somebody will react to, as I said, which normally in normal circumstances people wouldn't do. Now, we often find that babies come in with, especially infants come in with lots of things like eczema predominantly and rashes and these types of things. And when we quiz the parents about their background, we often find that they may have some type of allergic reaction, whether it's if it's eczema in the baby, they may have an asthma or a hay fever or rashes, these types of things. So there's often a hereditary trait passed down from the parent down to the child, which can trigger off these types of problems. Now, we also tend to find that when mum has had a couple of children, so often the second child will often be worse than the first child, and the third may be worse than the second. This depends a lot on mum, in addition to the hereditary trait, also sustaining fatigue and not sleeping properly and not eating properly during the pregnancy, and every pregnancy forthwith mum becomes becomes more run down, and we tend to pass that trait on in addition to the hereditary trait. So we tend to find that the children are often worse as they go further down the line. Now, if you are suffering allergies for the first time, so you may be an adult, and you're a teenager, or in your 20s, 30s, or maybe older, and you're suffering for the first time with a rash or hives or psoriasis, and you've never had this before, that's normally a trait that's in your system, but it's been brought about by normally high levels of stress. So we often go through this with our patients, and we often ask them, you know, who died, how much money have you lost, somebody left you, have you gone through a divorce or a separation, what's happening with the kids at home, at work, you know, have you had any operations, have you been under stress or trauma, have you suffered any sicknesses, and we're looking for triggers which would have put pressure on the immune system, and we'll often go back 3 to 6 months, maybe even 12 months before that, before the allergy showed itself, and often pick out major stresses, emotional traumas, physiological traumas, which can have impacted on the immune system and allowed the immune system to start to make mistakes, and as a consequence of that initiate this overreaction to these substances. Now, the way in which we try to treat this is that we identify, or we look for identifying the triggers. Now, we often do that with a computerized testing facility, which is a non-invasive system. It's suitable for everybody down from infants from 4 to 6 months all the way up to mature adults. It gives us a very high correlation with real-time allergies, as would be denoted in the elimination diet, something like that, which is one of the standards for identifying this, but without all the hard work and 6 months of trial and error. So it gives us a very, very close proximity to that type of testing. So it's very, very, very useful in our clinic to help identify these things quickly and efficiently. So once we've identified these foods, what we like to do is take them out, give the body a little bit of a rest, and put the patient onto some type of immune recovery protocol. We often like to use things, specialized products like isotonic products, which are highly absorbed, highly effective super antioxidants, which can get into the bloodstream very rapidly, within 5 or 10 minutes, and initiate a recovery in what we found to be the shortest period of time. So by eliminating these things and then repairing the immune system and re-educating our patients, we'll often find that we can ascertain a long-lasting recovery without the use of continued medication. That's not to say that if you have something that you need medication from your doctor, that you would need to stop that, but it will at least give you the ability to go back to your medical specialist and then reevaluate under their guidance the appropriate dosages after we've done our work with you. So we'd like to think that we can offer our patients at least a viable alternative to, just symptom medication. So if you want to find out more information, log on to our website www.allergydiets.com.au or sensitivefoods.com, and there you'll find a whole heap of information on exactly what you do. Thank you very much, and I hope you found this interesting. From Douglas Mitzi, goodbye.